Why you must act urgently and treat pain quickly. Hey folks, I'm Dr. Jeff Williams with Creekstone right here in Amarillo, Texas. I'm coming to you again this week and I'm talking about how quickly pain can turn very troublesome very quickly. I'm going to say from the top, whether you know it or not, people you care about need to be educated on this so that they don't wind up with a lifetime of pain. So be sure you're sharing this video and this information with your people. And leave me a comment. Let me know what you thought of the information I'm sharing here. Now, why do we wait to try to get out of pain? And does it even matter how long we wait? Well, the short answer is absolutely yes, it most certainly matters if you wait too long, because waiting too long allows pain to transition from something new and innocent and easy to treat into something that can be very difficult to get rid of. Worst of all, this transition can happen very quickly without you even realizing it. And here's some of the reasons patients wait. I suppose there are plenty of reasons why people wait, right? Why do they wait so long before actually taking the steps to get out of pain? And I think one of the most common reasons is that patients think it'll just go away naturally. And let's be honest, they're usually correct. We can't always explain why pain comes on, exactly the cause of the pain, or why it just seems to go away as quickly as it came on. Spinal pain can truly be a bit of an enigma sometimes, and each patient is different with their own secret code to getting rid of that pain. This is why it's a good idea to go to a highly trained expert in spinal pain once you decide that it's time to actually do something about it. Another reason why patients tend to wait to be treated may be that they don't feel like they have enough money to pay for care at the time that they're hurting, which is understandable. We all know what healthcare costs in America can mean to us. In spite of the Affordable Care Act or Obamacare, costs just continue to rise, don't they? The good news, though, and the argument for treating with a chiropractor is that in nationwide comparisons with physical therapists and usual medical care, not to mention surgeons and all that good stuff, chiropractic care was not only more effective and safer and non-invasive, but patients were happier with their practitioner and their progress. But even more importantly, the care with the chiropractor also costs less, quite a bit less as a matter of fact. Yet another reason patients waited to be treated may just be that they think they're simply too busy to take time to take care of themselves. When a patient tells me that they've been too busy to take care of themselves or to give us a call, all that really means to a healthcare practitioner is that taking care of themselves just wasn't the priority. So be honest. If it's important to you, do you not make sure that it's at the top of the list? You make sure it gets done. And that's because you made sure it was important. For a healthcare practitioner, not having the time just doesn't hold a lot of water as an excuse. Resolving pain must be a priority if we're going to keep it from turning long-term or chronic. While the reasons for waiting too long to be seen may vary, the outcome is consistent. What we see every week is that patients have been hurting for far too long, and they don't know how they ended up at the point that in the condition that they're in when we're sitting here looking at them. Certainly, some patients worse than others. Now, unfortunately, there's a timetable on pain and how effectively pain can be treated. The National Pain Strategy defines chronic pain or long-term pain as pain that is experienced at least every other day for 6 months or more. Other respectable publications say that pain turns chronic in as little as only 3 months. That's highly concerning, folks, mostly because once pain turns long-term or chronic, it becomes much more difficult to treat and to resolve. It's hard to get rid of. Think about that for just a second. If patients allow pain to persist for just 3 months, the chances of knocking it out completely start to go down almost immediately. Wow, right? Have you thought about it that way? It's pretty sobering when you consider that in the grand scheme of things, 3 months that's not very long at all. 1 week turns into 1 month before patients even know it or realize it. Then 1 month turns into 4 or 5 months. Patients sometimes will get a little bit better, but then they retreat, the condition gets aggravated, they get sore again. Pretty soon the patient is sitting at 6 months in pain, and now it's extremely difficult to get rid of. And that's the exact reason the global population needs to have a higher level of pain literacy, meaning patients need to be educated to understand that you can't allow pain to persist beyond just a month or two. And you can't go on thinking it's just going to go away once it gets that far into it. It has to be attacked promptly and effectively. If the patient simply understood the rapid transition of pain from being short-lived or acute, transitioning into long-term chronic pain, if they understood this stuff, they could have been proactive, and they could have been treated quicker and much more effectively. So that's basically my message for prospective pain patients, people suffering pain. There's absolutely a timetable on pain, and you simply cannot allow it to persist for 3 months or more. It is in your best interest to have any pain you may experience treated fairly promptly if you want to get it resolved and move on with your life. That doesn't mean if you're having chronic pain we can't get rid of it. We can do a lot with chronic pain, especially at places like Creekstone. But it is harder to treat, if we're being honest, than the short-term pain. So might as well keep it short-term and don't let it transition. Now, what kind of doctors should you see? Well, the largest medical industry groups and associations, not to mention national polls, state clearly that non-pharmacological, non-invasive treatment is the first kind of treatment patients should be seeking. But what does that mean exactly? Well, fortunately, the American College of Physicians breaks it down very clearly for everyone. Now, in no particular order, a patient's first treatments for back pain, short-term and long-term, should be as follows. Spinal manipulative therapy, meaning go to a chiropractor. Exercise rehabilitation, we do that, go to a chiropractor. Soft tissue manipulation or massage, go to a chiropractor. We do soft tissue manipulation, plus we have massage therapists that work here. Low-level laser, go to a chiropractor. We got one of those. And heat, go to a chiropractor. We have moist heat here. Then there's cognitive behavioral therapy. The right chiropractor can offer you guidance on cognitive behavioral therapy. Then yoga and Tai Chi. Now, while I may appear to be a biased chiropractor, and let's be honest, that's a fair assessment, it's also a fact and very honest that these recommendations come from one of the largest medical groups in America and supported by many of the other largest medical groups in America. It's also honest and a fact that chiropractors perform the majority of these recommendations. So while I'm biased, it's also a fact. Now, does the type of chiropractor matter? Quickly, I'm just going to say that the type of chiropractor you choose is extremely important. You should make sure that you are visiting an evidence-based, patient-centered chiropractor. A good start to finding such a chiropractor as this is by visiting the Forward Thinking Chiropractic Alliance member map. I'm putting the link down here below for you, but it's forwardthinkingchiro.com/member-map. These chiropractors typically follow the research and follow current guidelines, and they implement them into their daily patient care. The kind of chiropractor you choose absolutely makes a difference, so make sure you're making the best decision you can. If you're in Amarillo, again, I'm biased, but I am the only fellowship-trained orthopedic chiropractic specialist in West Texas. I've been recognized in court as an expert on whiplash. I can handle your car wrecks. And I host a weekly podcast based on the most current guidelines and research papers having to do with pain and the treatment of neuromusculoskeletal pain. So I'm on top of it. I'd love to help you and your loved ones. If you're from the Amarillo area, or you'll be passing through and you need to be seen by us, call us at 806-355-3000. Let's get you on the schedule. If you're watching this on YouTube, subscribe, won't you? Leave us a comment. Let us know you were here. If you're watching on Facebook, we'd love a like, a share, and a comment. Those are the things that make social media go around, right? And I promise we can help some of you stay out of lifelong pain if we get this information out there. Again, I'm Dr. Jeff Williams with Creekstone right here in Amarillo, Texas. We'll see you again next week.